A woman, 32 years old, married, first consultation on October 9, 2003. Chief complaint: long menstrual intervals, markedly reduced menstrual flow for more than 10 years, and complete cessation of menstruation for 2 years. The patient began menstruation at the age of 15 with a normal menstrual pattern. In June 1993, she became pregnant and experienced a spontaneous miscarriage at 3 months with relatively heavy bleeding. Since then, the menstrual flow decreased month by month until menstruation stopped completely 2 years ago. She took many Chinese herbal medicines without effect. Her body gradually gained weight. She had a poor appetite. Her stools tended to be loose. The amount of urination was small. She felt fatigued and lacked strength. Even slight activity or exertion caused profuse sweating.
She had mild aversion to wind and cold. She experienced pain in joints throughout the body. The lower limbs were swollen. Sexual desire was diminished. Vaginal discharge was profuse, white in color and thin like water. Because she was unable to conceive, her mood was depressed. The tongue was enlarged, with scalloped edges resembling teeth marks, and the tongue color was somewhat dark. The surface of the tongue appeared to be covered with a white, muddy-like layer of shatai. The mai could only be felt with firm pressure and felt thin like a thread, yet smooth and rounded. The physician believed that there was excess water and damp accumulation inside the body, leading to the cessation of menstruation. Jin Gui Yao Liwei states, "When excess water is expelled from the body, menstruation will naturally resume." The physician prescribed Fang Ji Huang Qi Tong as the foundational formula.
Stephania root, Fang Ji, 12 grams. Astragalus root, Huang Qi, 20 grams. Atractylodes rhizome, Bai Ju, 15 grams. Poria, Fu Ling, 20 grams. Raw Job's tears, Sheng Yi Yi Ren, 30 grams. Sautéed Job's tears, Chao Yi Yi Ren, 30 grams. Alisma rhizome, Zai Xie, 12 grams. Agastache, Ho Xiang, 10 grams. Perilla stem, Sugung, 10 grams. Saposhnakavia root, Fang Feng, 10 grams. Cyperus rhizome, Xiang Fu, 10 grams. Motherwort, Yi Mu Cao, 15 grams. Plantago seed, Cheqian Zi, 15 grams. Honey fried licorice root, Ju Gan Kao, 10 grams.
This was 1 day's dosage. The herbs were decocted together into a soup, and the liquid was taken in 2 doses per day. The physician prescribed the medicine for 7 days. After taking the medicine, aversion to wind and heaviness of the body were reduced. Swelling of the lower limbs subsided. The tongue and mai showed no change. The physician considered the treatment to be effective. Fang Feng was removed, and cinnamon twig, Gui Ji, 10 grams, and ligusticum rhizome, Chuan Sheng, 10 grams were added. This both replenished heat energy and promoted smooth circulation of Shui. The physician prescribed the medicine for another 14 days. On the 12th day of taking the medicine, menstruation resumed, but the flow was very scant, pale in color, and ended within 2 days. Other symptoms improved, and body weight decreased to 76 kilograms. The physician continued to adjust the prescription based on this formula. After more than 3 months of treatment, body weight decreased to 65 kilograms. All other symptoms disappeared. Menstrual cycle, flow, and color returned to normal. On February 26, 2005, she delivered a healthy baby boy naturally. The doctor concluded by saying, Jin Gui Yao Lui states, "When edema appears first and menstruation stops later, it is due to excess water inside the body. When excess water is properly treated, menstruation will naturally recover. Therefore, treatment should first use Fang Ji Huang Qi Tong to expel excess water. Afterward,
Herbs that replenish heat energy and promote the movement of shui are added. Once all symptoms resolve, pregnancy and childbirth can occur naturally. Notes: 1. Shi Tai, a traditional Chinese medicine term referring to the substance covering the surface of the tongue. 2. Fangji Huangqi Tong, a classic ancient herbal formula name. 3. Shui is a TCM term, is produced from extremely refined substances after being transformed by qi. It is responsible for nourishing and moistening the entire body, and it is also the material foundation for our mental and thought activities. Shui is different from blood. 4. Qi is a TCM term, is an extremely minute, highly vital substance that circulates constantly within the human body. This includes the qi of breathing. Qi drives and stimulates various physiological activities in the human body. The cessation of its movement signifies the end of life. Some substances in the human body are constantly present yet invisible, and some even exist only when the human body is alive, such as the qi of breathing. 5. Mai is a traditional Chinese medicine term. It is the place where shui is stored and circulates. In diagnosis, it specifically refers to the pulsation site at the wrist. 6. Jin Gui Yao Li. It was written by the medical expert Zhang Zhongjing, and it is the earliest specialized book discussing the diagnosis and treatment of miscellaneous diseases, recording over 60 types of illnesses and 262 prescriptions.